Hello, anatomy friends. This is Dr. Alsip, and in this video, we will be discussing the basics of the vertebral column. So specifically, we will describe the anatomy and the structure of the vertebral column. So what that means, we're going to really talk about the 5 regions and the names of the major joints of the vertebral column. So this is just a beginning. We will spend a lot of time on the vertebral column throughout the course. All right, so the vertebral column is typically composed of 33 vertebrae, different vertebrae. This is why that column is flexible because it's composed of these many different bones. But we typically talk about the vertebral column as we split it into its 5 regions. Movement of the vertebral column only occurs in the superior 3 regions. So let's start with the most superior of the vertebrae, and these are going to be the cervical vertebrae, which are located in the neck. You can see here on this image on the right. There are 7 cervical vertebrae, and these are also the smallest of the movable vertebrae due to the fact that they bear less weight than, say, particularly the lumbar vertebrae. These vertebrae are going to be labeled C1 through C7, which I want to note is also the way you label cervical spinal nerves, as in there will be a C, and then with each spinal cord segment from which it derives, so say from the first spinal cord segment, that would be C1. So you really need to be aware of what you're discussing when you see these abbreviations. It could either mean you're talking about the individual vertebrae, or you could be talking about the individual cervical spinal nerves, and that will be the same for the rest of the vertebrae and spinal nerves. Now, I want to note here, you see some blue text. And in previous videos, I had a blue box when I was having a clinical consideration. But in certain slides, I don't have the room for the box, so I will just have blue text. So the blue text also indicates we are highlighting a clinical consideration. So what I wanted to highlight here with the cervical vertebrae is that disorders such as, say, osteoarthritis or trauma such as fracture or dislocation of cervical vertebrae could directly affect the cervical spinal nerves that exit the vertebral column at that level. And so, depending on the severity, that can cause pain, numbness, or weakness of the upper limb because those cervical spinal nerves are directly affecting the upper limb. But in something that's very severe, like a very severe injury, it could affect the spinal cord that also traverses these vertebrae. And these could greatly affect structures that are distal or inferior to this region, potentially causing paralysis. So, a very important region, both in terms of the spinal cord traversing this region as well as the cervical spinal nerves. All right, moving down the vertebral column, you next reach the thoracic vertebrae, of which there are 12. These are located in the upper back region, and importantly, these are also going to be the vertebrae that articulate with the ribs in the thorax. And due to its articulation with the ribs, these are still mobile vertebrae, but they are not as mobile as what you have with the cervical or the lumbar. So these will be the least mobile of the mobile vertebrae. Now we get to the giants, the largest vertebrae. These are the lumbar vertebrae, of which there are only 5, but these are very large, so they actually take up a good amount of real estate, and they are large because of the amount of weight that they bear. These are located in the lower back. That's why you often hear that lower back region referred to as the lumbar region. And we will discuss the lumbar region in more detail in the neuro and musculoskeletal components of the curriculum, because these vertebrae are often considered in issues of lower back pain. And because the spinal nerves that exit from the lumbar vertebrae will go on to innervate the lower limbs, that pain can radiate to the lower limbs if you have compression of those spinal nerves. All right, let's move to the immovable vertebrae. but these are still considered to be part of the vertebral column because they are. These are often referred to as their bony name, so what the bone is from the fused vertebrae. So for example, the sacrum is a bone, and it is going to be composed of 5 fused sacral vertebrae. And there is not movement between the sacral vertebrae, as in there's not joints between the different sacral vertebrae because they have fused. They are a bony joint at that point, which means no movement. And you can see that the sacrum forms a triangle with the wider portion being at the top in comparison to the bottom. And that's because that superior portion of the sacrum still bears weight, whereas the inferior portions of the sacrum do not. So you need a larger size in the more superior portions of the sacrum. And that larger superior portion of the sacrum actually transmits the body weight to the pelvic girdle at what's referred to as the sacroiliac or the SI joints. So a joint between the sacrum, aka the vertebral column component, and the hip bones. And there is actually a slight bit of movement allowed at the SI joint, just no movement between the different sacral elements. And last but not least, we reach the coccyx. And this is a very small bone of 4 variably fused rudimentary coccygeal vertebrae. These are quite small. You can see in this image here on the right. The coccyx is actually a remnant of the embryonic tail-like caudal eminence. So this is why this bone is sometimes called the tailbone. So if you've ever heard of tailbone, they are discussing the coccyx. All right, let's return to the movable vertebrae and discuss the joints of these bones. The big or major joint that's most often discussed are the intervertebral or the IV discs. These are located in the midline and between the bodies of adjacent vertebrae. So vertebral bodies make up the bulk of the vertebrae and are located anteriorly. So you can see the bodies between these 2 vertebrae here on the right, and then the IV disc in between the 2. Intervertebral discs are cartilaginous joints, so they're not synovial joints, which most joints are. And again, these are located between those bodies. Of all the movable vertebrae, the last IV disc is actually located between L5, or the 5th lumbar vertebrae, and the sacrum. Now, you may have heard of a slipped or a herniated disc, and it is at these intervertebral discs that this occurs. So the inner portion, or the nucleus pulposus, herniates through the outer layer, or the annulus fibrosus. So this inner portion could herniate out through the outer portion. And this herniation can actually impinge or compress the spinal cord or the exiting spinal nerves. So that has some tremendous clinical implications there. And again, we will return to this later on in the curriculum. Adjacent vertebrae will also have what's referred to as facet joints, where an articular process, so you can see an articular process right here. So you'll have the superior vertebrae, that articular process will articulate with the articular process of the inferior vertebrae. And so there will be 2 facet joints with each vertebrae, and this joint allows for gliding movements. So actually quite a few joints associated with the vertebral column. All right, excellent. We have reached the summary slide, so a bit more to review here than we've had in previous videos. So make sure to look through this, see if you understand these concepts. If not, spend a little more time on this particular area. And we'll actually revisit many of these concepts throughout the year and spend a little more time on each one of these regions as we talk about those specific areas. Now, as always, please reach out if you have any questions, and have a great rest of your day.